Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone. Good morning, or good afternoon, or whatever time of the day you're listening to me. Welcome to a fresh episode of ATP Hour. I am Bimisola Boyde. I'm a pediatrician, and on ATP Hour, we discuss important topics that affect the health of our children, and we also try to empower parents so that we know what to do when we notice any of these health issues in our children. This program is brought to you by Ask the Pediatrician Foundation. We are committed to the health and the well-being of all children globally, and especially in Africa and sub-Saharan Africa, where most of our children are still dying from preventable causes. So on whichever platform you're watching or listening to me today, I just want to say thank you so much for joining us, whether you're watching on our Facebook group or you're watching on our YouTube channel or on Instagram Live, or you're listening to me on Fresh Race Radio or the podcast. I want to say thank you so much for joining us today, and we will be discussing something very, very important today. We'll be talking about noisy breathing. Before I go into the topic of today, I just want to remind you that you can watch all the past episodes on the same channel you are watching or listening to right now. And if you have any questions based on today's topic or any of the other topics we've discussed in the past, or anything whatsoever that has to do with the health of your children, feel free to post your questions on Ask the Pediatrician Facebook group from Mondays to Saturday, and we'll be there to answer your questions. So our questions are evidence-based. They are from the pediatrician's perspective, so they are answers that you can rely on and that you can take to the bank, unlike any other social media platform where people just give any answers as they think best. So you can rely on whatever you get from ATP that is from the pediatrician perspective. So if you have questions, feel free to do that. And you can also email us on askthepediatricians@gmail.com. Perhaps you have a particular topic that you would like us to address, feel free also to send us via email. So thank you so much for joining me today. And today, as you can see, for those of you who can see me, I would be, or for those of you who are listening to, maybe you've seen the flyer, we're going to be talking about noisy breathing. I mean, as a pediatrician, I've been running ATP for over 8 years now, and this is one of the most frequently asked questions, maybe very close to that of my child is not eating and all that. It's also this question of the noise. My child is breathing, or I can hear some noise, and it is sometimes so difficult for parents to be able to separate what is normal from what is not normal. And a lot of time people ask questions, and it's so difficult for us to be able to answer because we can't see, we can't hear the child at that time. And most time I have to tell parents we need to be able to see and we need to be able to hear. And sometimes people even send me audio recordings of those sounds, and I'm like, I need to be able to see how the child is looking when making the sound, just to let us know it's not every sound that babies make or that our children make that is a cause of concern. But as parents, naturally, we tend to worry about everything. And so it's not unusual for, especially for first-time mothers, to be worried about the noise or the sounds that they hear from their babies. And so we get lots of questions about noise or about the way the baby is breathing, how about the sound the baby is making when breathing. And sometimes it's difficult for parents to be able to separate what is normal from what is abnormal. And also, when do you intervene? What do you do, in such situation? So today I'm just going to give a big overview, because it's a broad topic. I'm just going to give an overview of this topic of noisy breathing and try to help us to know when should we worry and when should we not worry, and when is the breathing a source of concern, or when we don't have to worry about it. So it's a very common thing in babies, newborn babies, older babies, children, to have some form of noise. And we do get a lot of questions around it, like I said. However, these noises could mean different things. There are different conditions in children, especially conditions that are around the airway, that can make children to present with noise. And some of them are really nothing to worry about, okay? However, some of them may be signs of something more serious. For us to, some of them are even like an emergency situation, like we have to intervene straight away. So it is something that we should be familiar with as parents. However, in most cases, noisy breathing has to do with the airway. So the airway starts from our nose and it goes down to some other structures in the around the neck area, then going down into the chest area, you have the trachea, then you have the lungs. So it's a whole lot of structure that are involved with the movement of air from outside into the lungs and for them to circulate around in the blood. And so anything that causes some partial or sometimes even total blockage or narrowing of this airway in children can present with this noise. So also most of the time when you hear noise, noisy breathing, it has to do with either there's narrowing or there's blocking somewhere along the airway, starting from the nose further down to the lungs itself. So anything causing partial narrowing or blocking along the airway can present with noise. So it can be from the nose, it can be in what we call the throat, it can be also at the larynx or the voice box where the sounds that you can hear is coming from. It can be in the trachea or what we call the windpipe, or it can even be further down in the lungs. So most of these noises has to do with some form of narrowing, in the airway or along the airway. There are many things that can cause this kind of narrowing. It could be due to either there's a collapse, or it could be that there's something else that has come where it should not be. But whatever it is, there is some narrowing. And because there's narrowing, when there's airway movement into the respiratory tract, there's some kind of turbulence, so there's some kind of noise that comes as a result of that narrowing that has occurred along the airway, and that is what we now hear as noisy breathing. And there are different type of them. We have some jargons for which we refer to them. So you hear doctors talking about things like stridor, you hear us talking things about wheeze, you hear us talking about all sorts of names. But I don't want to stress you with all those names, because I don't think it really matters. But what it matters for us as parents is to know which of those sounds are of serious concern, or what other things we will see that will make us to know that we need to do something about it and all that. So, but wheeze, tends to be narrow, high pitch, while stridor tends to be It's also high pitch, but it's not as fine. It tends to be, maybe quasi. And don't let me put it that way. And you also have some other ones like that. So those are the different kind of sounds that we hear in children. Now, let's go into what are those things that can cause this narrowing. So what I've been telling us about is the noise we hear with children, with the breathing, has to do with narrowing along the airway, whether from the nose, the mouth, to the throat, to the trachea or the lungs. But what are those things that actually leads to this narrowing in the first instance? One is, of course, is infection. There are lots of infections that can occur along the respiratory tract, and because most of them are viral infections, so you have a lot of viruses that can cause infection. And when they cause infection, when these infections happen, there is some swelling, you know. And because the way the airway of children are, I didn't go into the anatomy because I don't want to get us bored with all those medical jargons. But the difference between children and adults is that the airway in children generally is narrower compared to that of adults. It's also not as stiff, compared to that of adults. So when there is infection, there's what we call inflammation, there is some swelling. But because the children's airway are already not very big, they are already small, and they are not even, rigid enough, any little swelling, it seems as if it just make the narrowing much more obvious compared to what would have happened in those of us who are adults. So whether it's bacterial infection, whether it's viral infection, most of these tends to cause swelling along the airway, and they tend to make narrowing of the airway much more worse. And then when hair flows down into the airway, then you hear a lot of noise. So example of infection, the most common one that we tend to get in children is what we call bronchiolitis. So bronchiolitis is not the same thing as bronchial asthma. Bronchial asthma is not an infection, but bronchiolitis is one of the viral infections that can occur in what we call, the part of the airway we call the bronchial, the branches that come out of the trachea into the lungs, and that infection present as if the children are having asthma because you hear them wheezing. You hear them wheezing a lot. So, but if the infection occurs in the upper part of the airway, you can have things like croup. You can have things like even that tends to give children more what we call like stridor, kind of sound. So if it is happening even down to the lungs, you can have narrowing of this final, airway in the lungs, and you can have sounds that will look like if the child is having bronchial asthma as well. So these are things that can happen in children. So in croup, you tend to get more of the stridor because it's much upper, whereas in bronchiolitis it's lower, and you tend to get more of the wheezing and all that. So that is one reason why the children can have noisy breathing from infections. Another reason why children have noisy breathing is when the babies themselves were being formed in the womb, there could be some abnormalities around the airway. The babies are born that way. They are born with something either pressing on the airway from the outside or from the inside, and so that's can also cause some form of noisy breathing. So you have things like we call subglottic stenosis and all that. These have to do with some narrowing that happens right from the beginning. Also, sometimes if something is growing around the airway, and like maybe some blood vessels are too big, or some like what we call it meningioma and all that around the airway, because the airway is a very soft and narrow structure. Anything growing around it and pressing on it will cause narrowing, and when air movement is going in, then you can hear the noise as well. And you can also have some issues with the structure of the airway itself, and in which it is not yet fully matured, if I can put it that way. So, for example, the larynx, if it is not fully mature, you can have what we call laryngomalacia. So, when hair is moving in and out, it's like the larynx itself is also, changing its posture, and that will cause a lot of noise. And that's because the tissue, or that part of the airway itself, is not properly formed. Also, you can have some situation where we can have an abnormal sudden constriction or narrowing of the airway, what we call spasms, maybe for whatever reason. And like some people have an allergic reaction to something, and then the airway kind of suddenly, close for, because of that reaction. Or like asthma, for example, is also what happens in asthma due to exposure to particular, what we call trigger or allergens. The ear will begin to just narrow from that, and that can also cause, that noisy breathing. And so these are all various things that can cause noisy breathing in children. But I think the most important thing for us as parents is to know which one is it that we should worry about and which one should we not worry about. So I will just talk about the common ones that children tend to have. Number one, for babies, especially because when they are born, their airway is still very soft, is still is small, is soft, it's not yet very rigid. So any little hair moving in and out, you can hear some noise. So most of the time, we don't worry so much about those noise. We look more about how the child is looking when they are making the noise. Okay, so it is not the noise per se that we worry about. It is the general picture of that child. So is he a noise that is making the child uncomfortable, or is it a noise that is also, or the child is otherwise well and is doing well? So we really need to have that picture in our head, so that that will help us to know when to worry or when not to worry. Now, let's also start by saying that for children under the age of 2 years, when you hear all this whistling sound in them, the whistling sound is kind of sound you hear in people who have asthma, but in children usually under 2 years, most of the time it is not asthma they have, it is the infection that we call bronchiolitis that they have. And in this age group, they tend to have a lot of cough, a lot of colds and runny nose, and that can, due to all those viruses and viral infections, and that can lead to them having those noises. So what really matters is, how is the child when they are having the noise? Is the child struggling to breathe? Because noises itself is not necessarily difficulty with breathing. Okay, child you can be hearing the noises, the sound, the wheezing, the stride, or whatever, but the child may be otherwise well and eating well and playing well and all that. So that child is not having difficulty in breathing. And that's why some of you, when you post your pictures or videos, or you send us just audio with a blackout video, I always say that we can't make use of that, because what we have looking out for, it's not just that sound the baby is making, it is the way the child is presenting. Is the child in distress? Is the child struggling to breathe? Those are more important information, and that is why we need to see. I always tell mothers, I need to see the nose of the baby, I need to see the mouth, I need to see the even if possible the chest. I want to see whether there are signs of difficulty with the breathing, or this child is calm, relaxed, happy, and then that will help us to know which ones it is. So if a child is having difficulties with breathing, no matter which sound you're hearing, that is an emergency, because difficulty with breathing is always an emergency. It means we need to do something now. And how do you know a child is struggling to breathe? You will see their nose flaring. It's as if they need to expand the nose the more so that hair can come in. Or you can see them, you can see the tissue around the neck, going inside, or the spaces between the lung, you see it going inside. You see that they are really struggling, to breathe. And that is a sign of, oh, we need to do something, and that child needs to go to the hospital. Sometimes babies generally tend to breathe faster than adults. So most of the time, people always say, oh, my baby is breathing too fast. But sometimes it's because we are comparing ourselves um, to the children. We breathe maybe, most adults will breathe maybe 12 to 14 times in 1 minute, but a newborn baby will breathe 60 times in 1 minute, whereas a child between 1 to 2 will breathe about 50 times, and 2 years old will breathe about 40 times. So the breathing tends to get slower as we get older. So if you look at anyone, be like, oh, are they breathing too fast? No, they are not breathing too fast. That's normal for them. And that is why we sometimes we have to count the respiratory rate. And sometimes people send us videos of 15 seconds, and like, I won't be able to know the respiratory rate in 15 seconds. We need to count it for at least a minute. And so that's, again, you're not beginning to see why I say sometimes it's difficult to assess respiration just by asking questions without videos, or a very short video, or one that is not even showing the face or the mouth or the nose of the child or the chest. Well, so most time we have to recommend, if you are worried about your child's breathing, that you have to go to the hospital. So now let me talk about what are the signs that you really need to worry about. And I think that is the most important thing for us to know. I'm not expecting us as parents to be able to figure out the cause of the noisy breathing and all that. That is for the doctors to work out. But there are what I would call like the red signs. What are those signs that when you see, you know that this is something serious, this is something sinister, this is an emergency, I have to take this child to the hospital now? Number one is if the child is struggling to breathe, difficulty with breathing. I think I'm emphasizing that. And one of the signs of difficulty breathing is the breathing appears to be even faster than what you noticed before. There's flaring of the nostrils, there is what we call indrawing of the muscles, and then you can hear you can see that this child is really, really struggling to breathe. No matter what sound you hear, or what, still, if you don't hear any sound and the child is struggling to breathe, that child needs to go to the hospital. Another thing is that you see the lips, or the tongue of the baby turning blue. This is easier for our Caucasian children, or children that are fair, but for the Black Africans, you see that as if the lips is looking dark. Even for us, so the inner part of our lips tend to look pink or red. So if you see it looking like it's dark, it's black, or we may not be able to see blue on us, then that is also a sign that we call it cyanosis in medical jargon, but that means that child is losing oxygen and there's not enough oxygen circulating in the blood, and that child needs to go to the hospital. Another sign that will make you want to take the child to an emergency room is, apart from the difficulty with breathing or the child having blue lips, is the fact that the child is the breathing is not regular. So the child taking a breath, and then it's as if they're still breathing for 10 seconds or more, and then the breathing comes again. Normally breathing is regular, in, out. But if you say that this breathing is just looking funny, it's not regular, then that child needs to go to the hospital. All right. Sometimes if you hear a very loud breath noise, we call it stridor. Sometimes it is easier when you've heard these things before, but once you hear funny sounds and they are present all the time, and in a child who is having all these other signs that I'm talking about, then you need to take the child to the hospital. Another sign is the child is too breathless to talk or feed or drink. So a child who is breathing, or who has this noisy breathing, and they cannot talk, if it's an older child who is already talking, or they cannot take a drink, that is serious. So if your child is so is having this noisy breathing that they can't suck. For the younger babies that will be breastfeeding, you see that the child wants to suck, they put their mouth on the breast and then they just suddenly take out their mouth. They can't even suck, they can't breathe, they can't take in any drink. Or if it's an older child who is talking, they can't talk. That is a sign of a child who is an emergency and needs to go to the hospital. Or you see that the child is feeling cold when you touch them, their hands is like a little bit sweaty and they cannot, it's cold to touch. That is an emergency. Or the child is just crying and crying and crying. No matter what you do, no matter what you try to do to make them calm, you carry them, you rock them, bribe them with all the things in the world, they just won't stop crying. They are very irritable. That child needs to go to the hospital. Also, if you see a child who is having this noisy breathing and they have a rash, or they're having fever, they are less than 3 months old, these are signs of a very sick child that needs to go to the hospital. So I hope you'll be able to grab the picture now. So the noisy breathing itself per se is not the issue. It is what are the other things that are present with the noisy breathing. So difficulty with breathing, child is turning blue, child cannot talk, child cannot drink, child cannot eat, child is having, all the flaring, all the indrawing of the muscles. These are emergencies. These are children that really need to go to the hospital immediately. So that is the first thing I will need to talk about. But if the child does not have any of those other ones, you may still need to go to the hospital, but those ones are not like emergencies. Okay, so for example, if the child have some period where they are breathing with difficulty, but other times they are calm, or if they make some noise, they breathe, the noisy breathing is worse only maybe when the child is upset or crying, then that may also be, you need to go to the hospital, but like it's not like you have to go as an emergency and all that. And if the child is still having fever or the breathing is getting worse, the noise is getting worse, you also have to go to the hospital. Now, if the child is otherwise well, his child is having noisy breathing, but the child is not having the difficulty with breathing, the child is not turning blue, the child is sucking well, the child is playing, the child is happy, every other thing else apart from this noise. And some of people tell me, oh, this noise is only present when the child is awake, but when the child is sleeping, the noise seems to go away and all that. So those ones, they are not emergencies. Those are the ones that you can take your time and just watch at home. So those are the green signs. So green signs, the child is otherwise well, but you must make sure you're giving them, if they are less than 6 months, you're breastfeeding. Above 6 months, you're making sure they're taking other drink as well. The child is, when you give them a drink, they want to drink very well. They are not irritable and all that. These are the ones that you can just take your time and just watch them. You don't need to rush to the hospital. Of course, if you're worried, you can always come to the hospital and then we can always advise you on what to do. So children who have noisy breathing, I think the most important thing for parents, after we've sorted out the one that you have to is an emergency, is sometimes parents just want to know what is wrong. And like I said, for us as doctors, sometimes we need to see the children to know what is wrong, because when we see the children, we can do what we call a full examination of the respiratory system. We can count the respiratory rates. We can listen for the sound and the kind of noise they are making. And from the noise, we'll be able to say, oh, we think this obstruction or this narrowing of the airway that is causing this noise is from the upper part of the airway or is from the lower part of the airway. The lower part of the airway tends to give what we call wheezing sound, finer, is high pitched, whereas the upper part of the airway tends to give more of the loud, rumbling kind of sound, what we call like the stridor. So that helps us. So from the sound we hear, we count the respiratory rate. We can use our stethoscope to listen, to the chest of the child. And so sometimes some of you will say your doctor tell you the chest is clear, that all this kind of thing. But there's a way when we listen to our stethoscope, we can hear some of those sounds as well. And then we'll definitely be asking you questions like, when did this noisy breathing start? Has this child been well, or is this something that started from the day the baby has been born? And I know a lot of mothers always think, oh, it's because they didn't suck my baby at birth. Okay, so let me quickly address that. Number one, we don't need to suck your baby at birth. You don't need to. Okay. Yes, babies live in water when they were in the womb, and they are breathing in inside the water. There's nothing wrong with that. So when babies are born, the way they pass through the birth canal, some of those water is squeezed out and it will come out when they are born. And so most babies are born, they are crying. 90% of babies are born crying and loud. We don't need to suck them. We don't need to suction them, because a lot of mothers always think, oh, babies have to be suctioned. And it's because when they go home and baby have all these noisy breathing, they think, oh, it's because they didn't suck my baby. And I see mothers asking me 3 months, 4 months after that, my baby is having this noise. So, and it's because they didn't suck the baby at birth. I'm like, 4 months afterwards? No, it has nothing to do with your baby being sucked. So we don't necessarily have to suck babies at all. But we will suck some babies if they are not breathing, because we want to kind of stimulate them. So it's more for stimulation. It's more to see whether the baby will start, we're kind of stimulating them to start to breathe on their own. So sometimes we suction them, unless your baby like passed what we call meconium, like passed the first stool while in the womb, and that the baby may have taken part of that stool into the airway. So what we do is to look under our what we call the laryngoscope, and then we can suction the feces, the meconium out of the airway, so that it doesn't go into the lungs and cause what we call meconium aspiration syndrome. Otherwise, most babies will not need any special sucking at birth. And so if you go home 1 week after, 2 weeks after, your baby is having difficulty with breathing or having some noisy breathing, please, it's not the suction or no suction that happened at the delivery. So like I said, there are other things, some people have what we call laryngomalacia. The airway itself is soft, kind of, and so they tend to have that noisy breathing a lot, but the child is otherwise well. They are fine, they are sucking well, they are happy, there's nothing wrong with them. So it could just be laryngomalacia. Sometimes we need to be sure there's no like a vascular ring or hemangioma, like enlarged blood vessels pressing on the airway. So those ones tend to be present right from the time the baby is born. Whereas things like bronchiolitis, things like other croup and all that tends to happen weeks and months after the baby has been born. So, and we know that, okay, usually mothers will give us this show. Maybe there was runny nose, there was cough, maybe there was mild fever, and then the child now starts having this noisy breathing. Then it is easier for us to know, okay, this is most likely from the infection and not from the not because of some other things that happen at birth and all that. So that is how we normally know which one it is. And I think the most important thing is for us to be able to treat it and tell you what to do. The good news is that most of those noisy breathing, they don't require any treatment. Yes, they don't. Like for example, most of those infections, like the bronchiolitis, the croup, most of them are due to viral infections, and most of them don't have any specific medications to that we use. So I think I will just take my time to talk about those two, because those are the common ones that we tend to see a lot in in children. So bronchiolitis is most of the time it's a viral infection. So the child may breathe faster. They may have, is a key feature of bronchiolitis is that wheezing. They breathe fast and then they're having this, I don't know whether I was able to make it very well, but it's like they're having a wheezing sound as what you get in those who are asthmatic. And the children sometimes they are very irritable, and it can last between 3 to 5 days. It's not a long illness, and it will usually by 3 weeks most children will be free from bronchiolitis. It doesn't have any particular drugs. Unfortunately, sometimes because parents worry so much and they're always on the neck of the pediatrician, and sometimes the pediatrician will feel like, oh, I need to give this mother something, or they will not be happy with me. So sometimes pediatricians sometimes just want to give something, but most of the time they don't. So what we do most time, sometimes we nebulize them with just normal saline, just to soften, the airway, because we know it's going to run its course. What the most important is that the child is well hydrated and all that. Some children have it so bad, and the oxygen saturation will begin to drop. Another, sometimes we just give them that oxygen, just support. So it's more what we call supportive treatment. We are just more or less waiting for that virus to run its course and go away. So most bronchiolitis don't require any drugs. They don't require for us to give the children antibiotics. We don't need to give the children steroids. We don't need to do that. We don't need to give them any of those asthmatic drugs, and all. We don't need to nebulize them with what we call bronchodilators like salbutamol and all that. We don't. We just need to support the airway and support the children until that virus, run its course and go away. Another common viral infection, but this one tends to affect the upper airway, is croup. So it tends to affect more of the trachea. So now we call it laryngotracheal bronchitis. So it's the trachea, the larynx, and the bronchi. Those are the ones that tend to happen in croup. And in croup, you tend to get this backing ash cough, this sound. It tends also have this sound we call stridor. It's not like the fine one of bronchiolitis. In croup is ash and it's backing cough, and it tends to happen in children. Some of them may have a little bit of fever, some of them may not have a fever. So most of the time, if it is mild, we're just sitting and waiting for it to run its course. So just make sure the child is well hydrated. Just make sure they are calm, they are comforted, because when they cry, it's gonna make it worse and all that. But if it's sometimes we may want, if they come to the hospital, if it's really like serious one, we may sometimes nebulize them with some steroid, and because what happened, there's some swelling around the throat, and that steroid, or sometimes we do adrenaline nebulization. It's just to kind of reduce that swelling and make it easier for the children. Sometimes we give them oxygen as well. And like I said, most of these things within 48 hours, most children will be fine, and all those symptoms will resolve. So again, it is not really like we are doing anything specific and all that. Another common condition where children tend to have a lot of noisy breathing is laryngomalacia. It's really in the newborn babies. Again, they have this what look like noisy breathing, but the child is otherwise well, and we check everything is fine. Again, that has to do with the fact that the airway is not yet very it's still very flexible. It's not yet very strong. So sometimes the ENT doctors, sometimes they may give some calcium, they may give some vitamin C, just to make sure to quicken the system. But most time we're just waiting for the airway itself to become stronger and more rigid and less flexible, and all those noise will go away. Again, most of the time, we don't need to do anything. So if a child is having noisy breathing but it's otherwise well, it is likely that the child does not have a condition that requires any intervention. That is what it means, okay? It means it doesn't require any intervention. The ones that tend to require intervention, they are the ones that tend to come with all those serious symptoms that I've mentioned earlier. So those are the ones that we really, really, really need to take to the hospital. They tend to come in as an emergency. They tend to come with the difficulty with breathing. They tend to come with all those other issues. And those are the ones that we have to seek help. And usually when we go to the hospital, the doctors, they know what to do, and then they begin to intervene and do the right thing. So there's no reason for us to start panicking for every noise in our children. It was one thing is for us to know when we should worry and when we don't have to worry. So most likely, if your child is otherwise well and your child is doing fine, you don't have to worry too much about the noise. If you have opportunity to go to the hospital, maybe for immunizations or for other reasons, you can always raise it with your doctors, nurses, the health visitors, and then they can always advise you, that this is, or reassure you. But if it is one of those ones presenting with those red signs, mostly difficulty with breathing, then that's when you need to go to the hospital, and then you'll be able to do that. Another thing that can cause noisy breathing, but this tends to come off snoring. I guess most parents are able to know the snoring, kind of sound in children is also the enlargement of what we call the adenoids, the tonsils, which is also some structure around the airway. It's not part of the airway itself, but because there are structures that are around the airway, the respiratory tract, when they get bigger, they tend to press on the airway. Remember what I said, most of the noise is because the airway is partially narrowed or blocked by something. And so adenoids, and when they're enlarged, which they tend to be big in some children are not so big. The thing with adenoids is that they tend to get bigger first, and then when the children are about around 4 to 6, then they begin to shrink. The adenoid are part of what we call the lymphoid tissue. They are part of those system in the body that produces our antibodies that protect us against infection and all that. So they are necessary, but sometimes they can become too big, and in the process they cause narrowing of the airway. And so mothers complain of their children, snoring or mouth breathing. They're always opening their mouth to breathe and all that. So usually the doctors, our ENT doctors, will examine such children. They will do sometimes X-ray of the neck just to see whether the airway is okay or not. Especially if the children are also struggling to breathe at night, so they are sometimes stopping to breathe. So we have what we call obstructive sleep apnea. They stop to breathe completely, then we worry about it. And sometimes we have to just take them out. I know a lot of parents worry so much about the surgery. So as much as possible, doctors don't want to do the surgery. We don't want to take out the adenoids. We just leave them because we know that eventually they may shrink. But if they are really so bad and they are causing serious problems, not just because of the noise, but now the child is struggling to breathe, they are stopping to breathe at night and all those other things. So the child is having recurrent infections. They're having tonsillitis more than 6 times a year. Then that's that among other will be indications for the ENT doctors to take them out. And most children tolerate the procedure well, and they are fine because apart from the tonsils, or the adenoids, there are other lymphoid tissues that will produce antibodies, so you don't need to worry so much about them. So that is another thing. And also, some children actually have asthma, and they can have it pretty early as well, especially there's a strong family history of asthma. So if there's strong family history of asthma, especially if it is recurrent, so the child needs to be nebulized, because sometimes when children have the first wheezing episode, we tend to just assume under less than 2 years old, we always assume bronchiolitis first. But if it's coming back again and again and again, usually it's more than 2 times, because bronchiolitis doesn't tend to happen again and again. It happens usually once or twice in a lifetime. Most of the time, that's it. But if a child is coming back like every month or every few weeks and having this wheezing thing again, I know some doctors shy away from making asthma diagnosis. They do, because I don't know whether we still have a lot of stigma around people being asthmatic and all that, but it's one of the most common chronic disease in children of school age. So some children can actually present as early as 1 year and they can have asthma. So, but usually we may not make diagnosis the first time they come. We think bronchiolitis, but by the time they come second, third time, yes, then we begin to think of asthma, and then we have to decide. We'll nebulize them, we'll treat them, and most of the time for asthma, especially if it is recurrent episodes, they have to be on long-term treatment. It's not just what we call the relieving treatment, like we just nebulize them and they get better. They have to be on preventive treatment, something not to make them come back again and again. And usually we'll refer them to our specialists in respiratory that deal with asthma and other respiratory conditions, so that they can be monitoring the children. Again, this is another condition that tends to cause the noisy, but this time is more of wheezing. And just to let us know that even as much as asthma is not the first thing we'll think about in this particular age group, but asthma can also occur and it can present as early as that. Another thing we need to remember is that some children can have allergic reaction, and they can have a bad one. They can have what we call anaphylactic reaction, like serious allergic reaction that will cause swelling around the airway. For example, children have allergy to nuts like groundnuts, peanuts, and just the exposure to it alone. And that's why most schools, we don't want, they are what we call nuts-free school, because some children have some of this allergy, and if everybody is bringing nuts into school, you never know who is allergic, and the person can have a very bad, severe allergic reaction or anaphylaxis, and that can lead to death sometimes if we don't quickly deal with it. So some children who tend to have bad ones, we give them like what we call EpiPen, like adrenaline, something they can hold with them, so that if there's a reaction, they can inject themselves quickly, to reverse the anaphylactic reaction. Another thing that can also cause noisy breathing sometimes, most very rarely, but foreign body aspiration, which is why we always encourage that we don't leave our children to be playing with, especially for children less than 3 years, they shouldn't be playing with small bits of toys that have small bits. And we shouldn't, I was saying, coming before I recorded this program, somebody was talking about a child swallowing a seed of one of those fruits, agbalumo, in, I think it's cherry, I'm not sure of the English name now, but it's a seeded fruit, and the child, the 2-year-old swallowed it. And I'm like, that should not even have happened at all. A 2-year-old should not have been given a fruit that have seeds like that. So toys also that have small bits that can come apart, we shouldn't allow our children, because at that age, under 2, everything goes in their mouth. That is it. Everything goes in their mouth, and in the process, they can actually aspirate it, and that can cause, though most time it doesn't cause noisy breathing, but it can sometimes present that way. But most of the time is, they are shocking. And that is how we tend to pick it up, unless they swallow it down. But it's something, again, that we need to be mindful of as well, and make sure that children under 2, under 3 actually, we don't let them have small bits of toys or fruits around them, that they can choke on as well. But sometimes if it's partial, it can also present with noisy breathing. I've seen even children put things in their nose, block part of it, and sometimes it could be a presentation. All right, thank you so much for listening today. Just to recap, we've been talking about noisy breathing in children, and bottom line is that anything that can cause narrowing of the airway in children can cause noise because of the turbulence of the airway of the air when flow coming down the airway that is partially blocked or obstructed. So that is why noisy breathing can happen in children. And we've talked about the various things that can cause noisy breathing, from infections to things that can press on the airway, to the fact that the airway itself is floppy and all that. And more importantly, we've talked about what do we need to do as parents. And basically, there are two things. If it's a child that is well, that is otherwise happy, eating well, smiling well, no concerns, most time we just watch and wait it out. We don't need to panic. We don't need to worry. But if there are signs that this child, in addition to the noisy breathing, is having difficulty with breathing, is having respiratory distress, is having change in color, looking blue, those are emergencies. That means there's something more sinister going on. And for those kind of children, we have to go to the hospital immediately. And I would just say that if you are not sure, sometimes parents are not sure whether this is the red one or this is the green one. Red one is I have to go to the emergency room now. We also have the one in between. That's okay. There's something going on, but maybe not as bad as the red symptoms, or whether it's the green one. If you're not sure, it's always best to err on the side of caution, which means go to the hospital and let the doctors check. A lot of people ask me questions about respiratory symptoms, and I always say, actually, if you didn't attach a video or you didn't attach a proper video, I always recommend you have to go to the hospital. We have to see the child. We need to see their nose, their mouth, their respiratory system. We need to examine them properly. We need to see the chest wall. We need to be sure that this child does not have difficulty with breathing. We need to check it. And if we are sure it's not those red ones, then we can now investigate for the cause. And if it's something which at least we can reassure you, and if there's something we can treat, so it is important that if you're not sure, that you take the children to the hospital. But you don't have to panic with every noise that comes with the breathing in children. The most important thing is to know the ones to go to the hospital for, or the ones that we just need to watch and wait, and it will resolve. So thank you so much for listening. If you have any questions about noisy breathing in children, feel free to reach out to us and ask your questions on our Facebook group, or you can send us an email on askthepediatricians@gmail.com. So thank you so much. And if you want to watch past episodes, I think we've talked about urinary tract infection, we've talked about ear infection, we've talked about anemia in children so far this year, and even previous topics other years. Feel free to go to our YouTube channel, our Facebook page, or our Instagram IGTV channel as well, and you'll be able to watch these episodes. And you can ask your questions Monday to Saturdays on our Facebook groups, and we'll be able to answer you. So thank you so much, and have a wonderful day. And it is bye from me. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.